So I welcome you all to our Safe Touch Awareness webinar hosted by the VIBGYOR Group of Schools. Founded in 2004, VIBGYOR Group of Schools, recognized as Best Education Brand of 2023 by the Economic Times, is a leading network of K-12 schools known for its academic excellence for over 2 decades. The group offers a unique range of world class educational programs for the holistic development of students in curricular and co curricular studies across all its schools. Under the leadership of Mr. Rustam Kerawala, founder and chairman of the institution, VIBGYOR Group of Schools is nurturing the academic growth and development of over 50,000 students nationwide across its 36 schools in 13 major cities. We are thrilled to have you join us today for this important session aimed at ensuring the safety and well being of your children. Our distinguished guest speaker for today is Dr. Shreya Dubey, MBBS, DCH, DNB Pediatrics, Fellowship in Neonatology. With her extensive experience in pediatrics and neonatology, Dr. Dubey will provide invaluable insights on teaching children about good touch and bad touch, fostering upon dialogues between parents and children, recognizing signs of discomfort, and creating a safe environment for your child. Please join me in welcoming Dr. Shreya Dubey. Doctor, over to you. Welcome.
Thank you so much. Thank you so much, Kiranji. So, thank you so much all for joining in. I'm really happy to see all of you here, and I am happy to be here. Sincere gratitude to the VIBGYOR Group of Schools, and I must say that I'm really grateful to the super sincere and super dedicated teachers who have organized this Safe Touch workshop for all of the parents. So very good. I'm really proud of all the teachers in this group in this school. So that's a good thing. So I'll just try to share the presentation and then we can move ahead. So I hope you can see the screen.
Yes, it is visible.
Okay, fine. Okay. So today we are going to talk about the safe touch awareness, and it is a very important topic. And today is going to be an interactive session. So if any of you have any doubt, you can put it in the comment section, and I'll try to address that question to the best of my capacity. I'm Dr. Shreya Dubey. I'm a pediatrician and a neonatologist, and I practice out of Gurgaon. I'm based out of Gurgaon, and let's with this session. The outcomes that we hope by the end of this session today is that we need to sensitize everyone about the importance of teaching children about good touch and bad touch. Also, we want to encourage continuous and open dialogue between you and your children. We want you to be able to recognize the signs of discomfort or distress in your child in case they experience a bad touch. We also want to establish trust between you and your child so that your child feels comfortable and safe to share their concerns and to report a bad touch if it happens to them. Also, we want to share some practical.
Dr. Dubey, I would request you to click on the presentation mode, please. So the screen will be more visible to everybody.
Okay.
Clearer. Slideshow.
Okay.
Yes, ma'am. Right? Done. Okay. Thank you.
Okay. Also, we would want to share some practical tips for the parents to create a safe environment at home and outside. So before I start with the session, I just want to ask you, how many of you have already broached this topic with your kids? Can you just show me with the hand raise? Okay, so I think I can't see it here. So many a times the parents tell us that whenever they try to broach this topic with their kids, there has been some awkwardness. There's some holding back from the end of the parent or from the end of the child. So First of all, I just want to tell you ki why is it so important to discuss about good touch and bad touch with our kids. Because first of all, child abuse, unfortunately, especially child sexual abuse, it is a lot more common than we assume. So I told you I'm a pediatrician and I work with kids and I have a special inclination towards behavioral pediatrics. So every day I see around 35 to 40 kids. And can you guess ki how many kids of child sexual abuse, how many cases of child sexual abuse I see in a month? It is roughly 4 to 5, and that's a huge number. And the pain point is 60% of the times the parents are not aware that something is going wrong with their kid. And it really breaks my heart uh, to see that the kid is suffering and the parent does not even know about it. So that's why this topic is really important. I'll just give you some examples. Uh, on a day in an OPD, just a child came, a 5-year-old girl came to me, and for the regular vaccination visit, it was the vaccination between the 4 years and the 6 years, and she came into the OPD and she had a teddy bear in her hand, and she was stimulating oral sex with that teddy bear. And I just looked at the thing and I asked the mother that what is happening, why is she doing this? And the mother just casually said, I don't know, doctor, she has just picked up this habit from somewhere and it's so embarrassing, and we repeatedly tell her not to do this, but she keeps on doing it. So then I talked to her and I talked to the parents, and then now the kid is safe, but then these are the signs that we miss out. Also also as I told you that I am very much inclined towards the behavioral pediatrics. Sometimes what happens is I work with a lot of teenagers also. So when the teenagers come, we all know that as the child hits puberty, what happens is that they become very conscious about their body appearances, about their physical appearances. So what happens is when the parents, they bring their teenagers to talk to me, just talk to me, they just ask me to talk to them just for the normal sexual talk, that how is menarche and how is puberty and how is puberty going to be. And when I just keep on talking to them, I realize that sometimes some kids are relatively more conscious about their body and about their physical appearances as compared to the other kids. And when I, session after session, when I keep meeting them, shocking stories come into play. So I remember one kid, she told me that when she was really young, her uncle pinched her on the buttock. And it was a very uncomfortable touch, and she could not talk about it to anyone because she thought it was uncomfortable for her. So she could not talk about it. She harbored that insecurity, that discomfort inside her till the age of 13 years. And when she talked to me, then I realized that it would have been so much easier for her if she had some tools, if she was comfortable to talk about it to the parents. She would have moved on. She would not have been trapped on that in that moment. So that's why it is so important to talk about this topic, because we want to give our children tools to help them understand boundaries, and we want them to recognize inappropriate behavior. Also, we want to strengthen the communication, the bonding, and the trust between the parents and between the children, so that it becomes easier for the kid to tell their parents about any bad experience if they have it. So that's why this topic is so important. So the most common bottlenecks, the most common explanations that the parents tell us, that which is holding them back from having this conversation with their kids. So these are that it is of course it is a difficult and uncomfortable conversation for the parents. Parents and children, both of them, they feel awkward. They don't know the right words. The parents think that it would be better if someone else talks to the kid about this subject, about good touch and bad touch. Sometimes the parents feel that the kid is too young for this conversation, they don't deserve so much adult talk. And sometimes the parents feel that if they talk about this to their kid, the kid will just pick on something and they will utter something in front of someone which is embarrassing, and the whole situation will become awkward. So that because of that fear, they don't broach this topic with their kids. So when should we start this good touch and bad touch conversation with our kids? So actually, your child is never too young to understand good and bad touch. So we should start as soon as possible. So when I say this to parents, the parents often ask me, "But what is the right age?" So if I talk medically, then before 18 to 24 months of age, that is before 2 years of age, the child is like emotionally labile. If they are in some discomfort, they'll just shout their lungs out, they'll scream their lungs out, they'll howl till they are in a comfortable position. So they don't take anything which is uncomfortable. They'll just show their displeasure anyhow. But after 2 years, many more emotions creep inside the children's minds. So they start to internalize things. They start to feel whether or not I should be telling this to someone, I should be telling this to my parent, yes or no. So they start choosing the things they want to tell their parents, and they start choosing the things that they want to keep themselves inside them. So these are the things. So that's why after 2 years, it is very important that you start conversing about good touch and bad touch. And even after 18 months, you should start telling the children about these things, because children, they imbibe everything. They are like copycats. They would like to imitate the way you talk, the way you walk, the way you are. So if you just start talking about this topic in front of them, so they'll gradually imbibe this thing also, and it will be comfortable for you as well as the kid as they grow to understand the topic much better. So how to start? So, before you start telling your kid about the good touches and the bad touches, it is important that you know how to deliver this talk. So, don't be shy, don't be too formal. Use a gentle voice when you are communicating with your kids about this topic, and use specific terminologies. Do not say things like down there, because the kids are really confused. So use specific terminologies like penis or vagina or anal region, to use specific terminologies. Also, be your usual self and then speak to the child about this subject. So why I'm telling this? Because many times we have seen that the parents are very uncomfortable when they're talking to their kids about this, and the kids' focus in them is then the parent, not the subject. So a 5-year-old came to me. The mother came with a 5-year-old, and she told me that, doctor, I have told him everything about good touch and bad touch yesterday, and I want you to reinforce it so that it gets internalized in his system. And I asked, first question that I asked the boy was, your mother talked to you about good touch and bad touch. How are you feeling about it? So he said that the moment stopped talking, na, my mother, I was so happy that she stopped talking, because it was making her feel so anxious and she was so stressed out. And then we laughed about it. But then it is very important that if you are feeling awkward about this topic, that how I will broach this topic with the kid, keep on revising it in your mind, keep on just telling it out loud in a separate room or something like that, till you become comfortable with the topic. Because we want the message to be delivered to the kid. We don't want your anxious or scared expressions when you're talking about this topic in front of your kid, because we want to give them the right message that it is okay to talk about it. So first of all, we need to use some affirmations. For example, if the kid is standing in front of me, I'll just say, this is my body and I respect my body. And I'll ask the kid to repeat it. I'll ask him, this is my body, this is your body. You respect your body, I respect my body. Just keep on repeating it till it becomes a game. Just keep on repeating it. This is my body, I respect my body, and there are some parts of my body only I can touch and no one else. Just keep on repeating it till it gets ingrained in the system of the bacha. So this is my body, I respect my body, and there are some parts of my body which only I can touch and no one else. So which parts of your body are meant for you to touch only? So lips, chest, bottom or buttocks, between the legs, that is penis or vagina, or the anal region. So these are the parts, these are my body parts which only I can touch and no one else can touch. Just keep on repeating this with the kid, keep on repeating this with the kid, or you can just follow the swimsuit rule. You make your child wear the swimsuit, and then you tell them that the parts of your body which are covered by the swimsuit, they are only yours to touch. No one else can touch them except you. So just keep it very clear. So no one is allowed to touch your private body parts, which are the lips, chest, buttocks or the bottom, and the area between the legs, which includes the penis, the vagina, and the anal region. Only your parents are allowed to touch it when they are bathing you or when they are helping you change clothes. Also, a doctor can touch them only in the presence of your parents, not otherwise. So just keep on telling them these things again and again, so it becomes a comfortable conversation, and gradually they'll get a hang of it. So once you have helped them identify their body parts and the private region and which parts are meant to be touched by them only and no one else can touch them, then you talk to them about feelings. So we need to tell them about good feelings and the bad feelings. So you can play a game of thumbs up and thumbs down with them. So when mama gives you a hug, so it's a good touch. And when someone hurts you, it's a bad touch. So when you go to the park, it's a good feeling. And when mama asks you to come back home and you don't want to come back home, it's a bad feeling. So play a game of thumbs up and thumbs down. And then tell them that when something happens to us, we can feel good about it or we can feel bad about it. In the same way, when someone touches us, we can feel good about it or we can feel bad about it, and continue doing this thumbs up and thumbs down thing with them, so that if in future you need to communicate with them, you can just ask thumbs up or thumbs down if they are not willing to talk. So that is very important. And then give them example. How do you feel when your friends shake hands with you? How do you feel when your grandmother hugs you? How do you feel when your friend gives a high five to you? And how do you feel when mama holds your hands? So, and then ask them if it is a thumbs up or if it is a thumbs down. So ask them, do these touches make you feel happy or sad? So good touches make you feel good, safe, and comfortable. Just keep on repeating and practicing it, and gradually over a period of 1 to 2 weeks the children will be memorizing it by heart. And then tell them about the bad touch, that not all touches are good. Some touches are bad and some make us feel uncomfortable. Also, just give them examples. How do you feel when someone puts their hands under your clothes? And how do you feel when someone hurts you? How do you feel when someone pinches you? And how do you feel when someone touches you in a way that makes you feel scared? How does it feel when someone touches your private body parts? And then remind them again, what are the private body parts? There is the chest, the buttocks, the lips, and the area between the legs, which are the penis or vagina and the anal region. So when you are having this conversation about the good touch and the bad touch, about the identification of the body parts, you please remember that you avoid to laugh, and do not scold your child when they are asking some silly questions or when they are too curious about the topic. Just focus on being supportive and give as factually correct answers as possible. So I have included this slide because it was very important for in my perspective. So so we are telling the kids again and again about the good touch and the bad touch, but we need to tell them about the unpleasant encounters also. Tell them that sometimes someone can touch us in the private region accidentally also, but they must say sorry in such case, and you must tell your parents about it. That sometimes someone can touch them accidentally in the private regions. They must say sorry in such cases, and you must tell your parents about it. And also, sometimes doctors have to give you injections, and that surely is unpleasant, but it is very important. So it is okay to be done, but it can be done only in front of parents. Why I have included this slide? Because a few months back, I took a workshop of good touch and bad touch for kids, and there were many attendees. And then one of the kids, they came for vaccination the next week, and the kid was 4 years old and she was on a little heavier side. She was a little overweight, and I had to ask two nursing staffs to hold her so that I could vaccinate her. And then she started to shout in the corridor, doctor did a bad touch, doctor did a bad touch. It was so embarrassing for me. So I decided that I'll include this slide so that you can just tell this to your kids. And then you need to repeat this. You need to keep playing this game of thumbs up and thumbs down. Give them as many examples as possible. How do you feel when doctor touches you in front of your parents? How do you feel when your grandma or grandpa give a hug to you or when they kiss you? How does it feel when your teacher pats you on the back to appreciate you? And how does it feel when a stranger touches your chest in a bus? How does it feel when a friend gives you a high five? How does it feel when the friend hurts you or pulls your hair tightly? And how does it feel when someone puts their hands under your clothes? And does it feel good when a friend tickles you near your private parts, and ask them to do a thumbs up and thumbs down, and just keep on reiterating it as many times as possible. Now we have identified the body parts. We have talked about feelings. So in the identification of body parts, we have already discussed about what are the private regions, how to name them, and in the identification of feelings, we have discovered the game of thumbs up and thumbs down. That is the good touch and the bad touch, the good feelings and the bad feelings. So we have decoded those two things. Now is the time. Now is the time for safe circle. So identify 3 to 4 people who you feel are safe for your kid. And then discuss about these 3 to 4 people with your kid, however small your kid is. Just ask your kid, do they feel safe and loved when they are with these 3 to 4 people? Can they speak freely when they are around these 3 to 4 people? And do they feel that they are happy when they're around these 3 to 4 people? Ask them this. And if you and your kid, they are both on the same page, then you assign these people as their kids' safe circle. Then you can just make the child practice again and these are the people who are in my safe circle. So you can give them photographs of the people, and you can ask them to paste the photographs on a cardboard so that they get a hang of it. These are the people who are my safe circle. I feel safe with these people. I feel loved with these people. I can talk about anything around these people. So just identify 3 to 4 people and tell your kids that whether or not they feel comfortable. If both of you are on the same page, then that designates your safe circle. So keep reminding your child about the safe circle. Now is the most important topic. So what to do if your child experiences a bad touch? So this is very important. What to do if your child experiences a bad touch? So tell your kid what to do when they experience a bad touch. Tell them that if anyone touches their private parts, or if anyone touches their private parts, and tell them that this has to be kept a secret, or if anyone hurts them or hits them, or if there is any incidence of bad touch, they should follow no, go, and tell. No, go, and tell. Train them to say no or stop in a loud voice. Train them again and again. Just ask them to say no in the loudest possible voice. So just practice with them. Ask them, encourage them to say no. Give them scenarios where they have to say no in a loud voice. So say no or stop in a loud voice, and then ask your kid, if someone touches you and it does not feel good, if it is a bad touch, shout no, then go or run to a place that is safe or there are many people there. If you can, you can just go and run away from there, and then you tell a person in your safe circle. The safe circle can be your teacher, it can be your mother, it can be your father, or any people you decided. So just no, shout no, then go and tell. Just ask them to repeat this no or stop in a loud voice. Then ask them and just keep on role playing this thing again and again. So I'll give you the frequency later in the later slides, but then just keep on telling them this is the motto: no, go and tell. Shout no, go or run to a place that is safe, and then tell a person in your safe circle. So for older kids, the kids who are more than 4 years old, we can also introduce the concept of traffic light. So green means good touch, red means bad touch, and yellow means the touch which is confusing. So this is for children who are more than 4 to 5 years, who are more aware of their emotions. So green is good touch, which is a safe and comfortable touch. So what are the examples of green or the good touch? Hugs from family members or high fives with friends. Red is totally bad touch. It is like unsafe or inappropriate. If someone is touching their private parts, or if somebody has touched them in any which way and have asked them to keep it a secret from the parents or from the teachers, then that's a red, yani ki that's a bad touch. And yellow touch, which is uncomfortable, which is confusing, from someone who the child doesn't know well. For example, hugs from a stranger, or someone is standing too close and disturbing their personal space. If just someone is standing too close to them and they are feeling uncomfortable, so ask them if they feel that the touch is in yellow zone, that is confusing, they are not able to differentiate between whether or not it was good or bad, then tell them to report to you. Tell them that they should come to you, and of course they have to tell you about the bad touch, that is the red zone. So there are some points to remember. Tell the child that as anyone else, no one else can touch their private parts. No one is meant to touch their private parts. In a similar fashion, they are not allowed to touch the private parts of any other person. Tell them that very clearly. That's in the same way that no one else can touch your private parts. You are not allowed to touch the private parts of any other person. Never undress. Tell them that they should never undress. They should never remove a clothing unless and until they are at home or they are at swimming pool in the guidance of their parents. So never undress except at home or in familiar surroundings in presence of their parents. So tell them these things. So there is a good touch and bad touch song. Shout no, then go and tell. The we'll just cover it in the links in the आगे वाला section.
Ma'am,
Also, teach.
there is one question related to this, which is
Yes.
how to ensure the child is safe
Yeah.
when they are out playing in the mall or a play area when the parents are not around them. What
Yeah. So
instructions can we give the child to keep them safe?
yeah, so that's the thing. First of all, of course, we can't be there with the kids all the time. So that is very very natural that as the kids grow older, they play on their own and they play with their friends, and sometimes they are having sleepovers also. So that's why it is so important that we tell them about good touch and bad touch, because if a situation is really really bad, we can't do anything about it. And thankfully, the situations are not that bad. But then they should know about the good touch and bad touch concept. They should know that they have to shout no, then they have to go, run away from there, and they have to tell a senior person. They have to tell the person who is in their safe circle. So that's the basic that we want them to learn. We can't control the external circumstances. If our child is playing in the mall and we are not around, first of all, we should try to avoid that. We should try to supervise the kids. There should be some senior whenever they are going out. But then if we are not around and something bad happens, we have to tell them how to get out of there. So that's the only way. We can't be sure of the external circumstances, and also at the same time we can't be overprotective. So that's why this good touch bad touch education is so important, so that they can protect themselves. And baki to, again, if it is a child, we should always supervise. So it is very important to reinforce that it is okay to say no to any touch that makes them feel uncomfortable. They have a right to refuse a touch from anyone, even if it is a family member. If they are getting hugs from a family member and they are feeling uncomfortable, they have a right to say no. They have a right, they should be saying no to strangers who offer treats and rides. And that's how we protect our kids when they go outside. We keep telling them that we cannot accept anything from the strangers. We cannot talk to strangers. We cannot be in a place where we feel that it is not a good place. So we have to make sure, because again, we can't be overprotective, but we have to take care of our kids. So let them know that you won't punish them or scold them for anything, and they can come and tell you if they have a bad experience out there. So tell them that even if they do something bad and something is bothering them, they have to be comfortable. They have to come to you, because just remember that our kids come with their own signatures, and they need to trust you. They need to trust you that you're going to be there for them. They should not be scared to tell you anything. So just keep telling them that whatever happens, they can always come and they can tell you that. So these things, these 4 points, they have to be practiced at home, because this is not a one-time exercise. Ask your child to draw pictures of the safe circle. Do as much role playing as you can. Play games with your child where they can practice shouting for help or saying no if someone pesters them. And this good touch and bad touch conversation, this can be practiced once. This should be practiced once a week for 6 weeks, then once a month for 12 months, and then once every 3 months till the child starts to memorize it. So the child becomes really good at it. They can repeat it in themselves like a poem. So this is a very important question: how to identify that something is wrong with your kid. What if your child does not tell you that something is wrong with them? So, several studies have reported that the most common sexual predator, unfortunately, is not some stranger, but someone who's well known to you and your child. So, please don't brush it off if your kid tells you about someone you trust. However trusted a friend or an uncle or an auntie she is, Do not brush it off if your kid is telling you something about them. Plus, how do we know that something is off with our kid in this aspect? Immediately, there's a change in behavior. It is like you cannot unnotice it. Immediately, there's a change in behavior. So please be alert around your kids. Understand, give them quality time so that you can understand the emotions that are going within them. So give them that quality time. Even 10 minutes of quality time per day is enough for you and your child to have a bond with each other. Also, in the presence of the abuser, the child will always show noticeable signs of distress. We'll discuss these signs later. But in the presence of abuser, the child either becomes rebellious or they become totally quiet. They become either very aggressive or they become very obedient. It's like a sudden shift in behavior. You can't unsee it once you know about it. So that's why it is very important to be aware about it, to have knowledge so that the brain only sees what they know. So that's the thing. What are the behavioral signs? So I gave an example in the beginning only. So the behavioral signs include sometimes the child starts to display knowledge of sexual acts which are inappropriate for their age. Sometimes they start using inappropriate sexual behavior language. And sometimes and many a times, we in our pediatric practice we see it many times that children start to simulate sexual acts with toys. And this is totally different from the dry humping that the kids do normally, but then simulating sexual acts with another toys or other objects. The humping is a normal thing. We'll talk about it later. So changes in behavior, sudden withdrawal or sudden isolation from friends and from family, excessive fearfulness, anxiety or depression, regression to earlier behaviors such as bedwetting, thumb sucking, or fear of the dark, sudden changes in school performance or attendance. And we already talked about it. The child can become extremely aggressive or extremely compliant. In the older kids, in the teenagers, they start becoming unusually secretive about their activities. They become reluctant to share certain information. They become very secretive. They stop sharing things with their parents. And again, in the smaller kids, there's a fear of being alone with specific individuals. They start to avoid certain places, even if it is kitchen or if it is a particular room or anything. They start avoiding that specific activity, specific location, or that specific individual. Sometimes the kids have start having too many nightmares or night terrors, and mostly the parents also come with this complaint that the child has suddenly experiencing night terrors at the age of 4 years. And we try to talk to the parent, and when we think that it is like continuing, we get some tests done, and then if the tests are normal, we think about psychological assessment for sexual abuse. So that is how we work. Difficulty falling asleep or frequent waking. If the sleep is not sound after 3.5 years of life, before 3.5 years of life, most of the times the sleep is not sound. The children, they wake up frequently, but after 3.5 years of life, the sleep should be sound. They should be able to sleep for at least 5 to 6 hours at a stretch. Changes in eating habits. After a bad experience, the child can have a sudden increase or sudden decrease in appetite. They might experience a sudden weight loss or sudden weight gain. So that is also an indicator. Physical signs. This is the most common thing that this is the most common thing with which the proper sexual abuse, the children who are proper sexual abuse victims, they come to us. These are the genital or anal injuries, which are very obvious. They might have a difficulty in walking or sitting because it is sometimes they have pain in the buttocks or something, so they have difficulty walking or sitting. We get some tests done, and then we examine, and then we know. Unexplained physical symptoms like stomach aches or headaches or other unexplained ailments. So these can also point towards that direction. And how we work around it is that first we rule out everything which is medical, then we try talking to the kid. If the kid is receptive and open, we welcome it. And then if not, then we think about the functional things and the psychological things, and that's how we progress, and eventually we get to know about it. Recurrent urinary tract infection. So this is a very recent case that I saw, that the child was having recurrent urinary tract. She was a baby, she was a girl, and she was having recurrent urinary tract infections, and we were getting the urine test done again and again and again. And in the second visit, when the child got a recurrent UTI within 1 month only, then the repeat examination. First time also I examined her and she did not have anything there. But on the repeat examination, I realized that she had an injury in the perineal region, and that's how we got to know about it. Bedwetting or soiling is a very common indicator, but it can be there in the other things also. So all these medical symptoms, they can simulate other medical conditions also. So that's why it is very important to get the bacha checked up with a pediatrician if you feel that there are any suspected signs. If even if you feel that there is no suspected sexual abuse, but if you feel that these signs are there, it's always better to just check up with your get your bacha checked up with the pediatrician. So psychological signs, sudden drop in self-confidence. All the kids, around 95% of the kids that I see of child sexual abuse, they can't make eye contact. They can't make eye contact. It is such an obvious tell. They can't make eye contact. They're just looking down, they are shy, they are not able to talk about it or about anything. There's a sudden drop in self-confidence, persistent sadness or mood swings, because they are able to make eye contact with the parents, whether or not they're telling the parents about it, but with the doctors and with other people, with strangers, obviously, there is a proper drop in the eye contact, and that's such a telltale sign. And some the teenagers, the grown-up children, they engage in self-destructive behaviors, so that we know mostly. And with and any kid at any age, if they experience a bad touch, there's always trust issues. They don't trust anyone, they don't trust us, they don't trust their parents, they don't trust any adult. So there are very strong trust issues, and that's what we work upon when we get to know that a child has had a bad experience or bad touch. So how do you counsel a child who has experienced a bad touch? Again, so this is a very common question that we get asked. How do you counsel a child who has experienced a bad touch? Whenever your child comes to you and they are brave enough to tell you that they have experienced a bad touch, your focus should be your child first and then the abuser. What happens is, as soon as a child tells their parent that somebody had touched them in a wrong way, what happens is the parents just go straight after the abuser. They become anxious, they start to cry, they start to hug the child, they start to cry along with the child, and they are like, the fathers, especially the fathers, what they do is I'll just find the abuser and I'll just take, they start to, it is like, it's a very common scenario that we see every single time. They have both the parents, they get focused on the abuser. No, that's a wrong thing. The more anxious, the more scared you are, the child will relate to the trauma more. It will be more traumatizing for the child. It's your job as parent to be calm and composed around them, however chaotic their mind can be. So whatever is going on in your mind, you have to show a calm and composed demeanor. That's the first thing. That's the basic minimum. So you approach them with a calm and composed demeanor. Stop thinking about the abuser. Just think about your child right now, because the abuser, we can deal with the abuser later. First, it is your child. So first of all, be calm, be composed. That will give them the courage and the strength to speak about it. And then you praise the child, tell them that, thank you so much that you came to me with this thing, thank you so much for speaking about it, thank you so much, I'm so proud of you, thank you so much for telling me this. So just praise your child for speaking up about their feelings, and then you tell them that, I'm always there to protect and support you. No one can harm you anymore. Keep repeating this sentence. I'm always there to protect and support you. No one can harm you. No one can harm you. Keep repeating them till they internalize that they are safe, they are secure now, they have your protection. That's the most important thing. And when your child is speaking about it, however young or however old your child is, just listen to the complete story without interrupting. If your child is not finding words to complete their story, then also just keep on listening. Do not fill in words for your child. Do not complete their sentences. Just listen to them. Just keep on listening without interrupting and validate what they're feeling. Oh, that must have felt so bad. Oh, that must have hurt. I'm so sorry, that must have hurt. So just keep on validating what they're feeling. Do not feel anxious. Do not feel angry. Just empathize with your child. I know you must be sad, but then still try to empathize with your child and tell them that you believe them. Do not ask them for proof. Do not cross question them. Never cross question them. If they tell you that some uncle has behaved in a wrong way with them, Do not tell. Are you sure? Are you sure you told this about that person also? You told this about the, no, that's a very, very wrong thing. Even if your child is lying, you'll come to us, we'll take care of it. But then you are the parent. Your responsibility is to trust your kid when they're telling you about this thing. So please, please, please believe them. Do not just shake it off. Also, do not force the child if they are not ready to share. Do not keep asking them, tell us, tell us, tell us, tell us. Do not force the child, because that will traumatize them further. And visit a pediatrician. I've been repeating it again and again. Visit your pediatrician. Your pediatrician is already connected with your child. They'll help you. If first they'll talk to your child, and then they'll help you connect with the child psychologist or psychiatrist, depending upon what your child needs. And then we come to the abuser, है ना? Then we come to the abuser. It is very, very important to report the incident in the police station. Nowadays, the child protective services, they are actually there's a child abuse cell, there's a child abuse unit in the place where I'm staying in Gurgaon. And the people, the officials, their personnel, they are really, really well trained. They talk very softly to the kids. Sometimes they don't even need to talk at all, but then you need to report the incident in the police station. You have to report it, so that any other bacha, any other kid, or any other person doesn't become a prey to that abuser. So please, please, please report it. And then you keep telling your child that it's not their fault, it's the other person's fault. Tell them it's not their shame. Tell them it's okay to look people into the eye. Tell them it's not their fault. Keep repeating that. And finally, and this is the most important thing, help the child return to their regular routine, to give them a sense of stability and normalcy. So what happens if some child experiences this trauma? What happens is the parents are in shock. Obviously, they are in shock. They are feeling helpless. They could not help their child. They're already in shock, and now they want to protect their child. So there's an extra overcompensation there. So what they do is they just keep on lingering onto the thing. Oh my god, they're like tiptoeing around the child all the time. So what happens is the child is totally off track, the child is totally off routine, and it takes a long time for them to get back on track. So give them 2 to 3, if there's no physical injury, then give them 2 to 3 days of rest and everything. Talk to them and be there with them and take them out, and whatever they want to do, they do them. But fourth or fifth day onwards, get them back on track. Try with the time that they used to wake up, the time that they used to go to school. So just get them back on the track. Otherwise, the kid will just keep mulling around the same thing again and again. Help them move out. Help them get out of the vicious cycle. Do not let them dwell in that thing for long. That does not mean that you distract them. It's like you get them back on the track so that they are able to cope with the thing better. And remember, this is very important, that if your child does not feel comfortable talking to you for whatever reason, help them identify the person in their life they can reach out to. It can be their teacher, it can be their doctor, it can be your friend, anyone. Help them identify people in their life they can reach out to. Do not take it personally. It is not your fault. Do not take it personally. Don't think that it's my fault that my child is not able to become comfortable with me. Don't think about that thing. Remember that we are all working together to support the child. We have to be on the same page. It is only about the child. It is not about you. It is not about the abuser. It is about our child. So please support the child in every which way you can. So this was something about the good touch and bad touch. And whenever I talk to the parents about this topic, there are many questions, and some of the regular OPD questions that I do get on a daily OPD on daily basis in the OPD. So I'll just discuss these questions with you. So the most common thing is कि my child rubs or touches their private areas too often. So this is an absolutely normal thing. It starts around 4 months, it peaks around 5 years, and then as the child hits puberty, the genital touching is usually done in the private. So how do we deal with it? So if you are at home, your child is at home and they are touching themselves or rubbing themselves in their private region, do not scold them, do not prohibit them from doing so. Instead, you tell them, if you want to touch yourself, if you want to rub yourself, please go to bedroom or bathroom. That means you limit the nudity to bedroom or bathroom. So never scold them, never demean them, or never ridicule them, and just tell them that if they want to touch it, they can do so in the bedroom or bathroom. If you are in a public area with your kid and they are touching themselves in the private regions again and again and again, you ask them not to do it. in the public areas, your child should not be touching their private region. Whenever you see them doing that, ask them not to do it. If your child is unconsciously or randomly just taking their hands in the private region again and again, you give them something to hold. If the hands are not free, they'll not go down there. So give them something to hold. And despite doing everything, if your child is not distractible, if they cannot be redirected from touching their private regions, then please visit your pediatrician. It can be a red flag. Also, do you change clothes in front of your kids? So again, try maintaining privacy. I understand for child safety, you have to be in front of your kids all the time, but whenever you are changing clothes, you can be in the same room, but use a curtain. Just use a curtain. The concept of privacy should start as early as possible. So don't change clothes in front of your kids. You can just leave them in a safe space on the ground, surround them with some toys, and fatafat say you can change into some clothes behind the curtain. But don't stop changing clothes in front of your kids, please. So another question that comes is, my child has suddenly picked an interest towards another gender. This is absolutely normal. This does not signify anything. Your child does not have the sex hormones yet. So don't worry about it. Let them develop an interest towards other gender. Just keep reminding them that in the same way that no one else can touch our private parts, we should not be touching any other kid's private parts. So just keep reminding them that.
Ma'am,
And
there is a question here. There's a question
yeah.
here related to this. I think so. There's a
Hmm.
question. It says, at what age can we discuss difference in the body part anatomy between a girl and a boy?
Okay, so ideally by 3 years they should know that gender difference is there. By 3 years, medically we say that by 3 years, a baby girl, she knows that she has a vagina. That is, she has different body parts, and the boy knows he has different body parts. But nowadays there are many nuclear families, so this difference can be spontaneously by themselves. They can just spot this difference by 3.5 years. But the usually this question arises around 2.5 years. The bacha will invariably come to you and they'll ask you, why does this kid stands while he or she is peeing? Why do I have to sit while I'm peeing? So that is the point where you start this conversation, that he has different private parts and you have different private parts. So ideally 3 to 3.5 years is the time. Earlier, if your child asks you earlier. So I have mentioned, okay. So I have mentioned some books on this topic. My Body Belongs to Me. This is a wonderful book by Jill Starishvisky. I said, no, your body belongs to you. Some parts are not for sharing. No means no. These are wonderful books for parents. They will give you a beautiful guide if you want to know more about this topic. Also, there are beautiful online resources exclusively for parents with every aspect. Whatever I told you, it is in a more detailed thing. So you can just go through these websites if you feel that you want to know more about it. These are wonderful, and they'll help you talk to your child better about this concept. So this is the summary. After this, there are 4 case scenarios from my day-to-day OPD practice. We'll just discuss them, and then we can take all the questions if there are any. So summarizing this, so it's high time we set aside the awkwardness and discuss the body safety rules frankly with children. Reinforce that no, go and tell. Shout no, go, run away from the abuser and tell it to the person in your safe circle. Shout no, go and tell. Shout no, go and tell. Remember that talking about good and bad touch is not a one-type conversation. It has to be practiced. It has to be repeated time to time. Only then you'll be able to communicate better with your kid. So it's high time we give our children the tools to talk about this topic. Otherwise, they'll just internalize the trauma, like many of the people in our generation do, and they'll just keep on internalizing the trauma, and then they'll be very just get them free. Let them be free. Let them be themselves. So it is very important to talk about this topic so that they become free. So first case scenario. So Meera is a 5-year-old girl, and she came to my OPD. She used to be very cheerful and outgoing. Her parents suddenly noticed that she has become very quiet and withdrawn. And I have been seeing her since the last 5 years. She was born under my care. And when she came to me, I just thought, because we see so many kids, so I just thought that must be because she has started the big school. So she started to avoid playing with her friends and often looked anxious. And then I noticed that she was not doing eye contact. She was shouting. She was like crying, and she preferred to stay. The parents told me that she preferred to stay alone. And then the mother told me, even if I try to hug her, she flinches. The mother then also told me that she has started to wet the bed again despite being toilet trained for years. And that's how we got to know. So whenever we have a case like this, we plan a multidisciplinary management protocol with a child psychologist, with us, and with some occupational therapists. We try to get the child out. Takes time, 3 to 4 months, and then the child is out. Children, they are really resilient. The only thing is we have got to know. We have to know when something bad happens, and for that we need to be aware. We need to have that knowledge. Another scenario. Jay, a 4-year-old boy, had been complaining of frequent stomach aches and headaches. Yes, a 4-year-old boy was complaining of headaches. His parents initially thought it was due to stress from school. We also thought the same. We thought the stomach aches are due to stress gastritis or because of the secondary lactose intolerance, which happens now as the child grows in height, the gastric acid production increases, and we thought that was the reason of stomach aches and headaches. However, the symptoms persisted despite medical treatment. The parents were coming every week, week after week, and then the parents noticed that there were unexplained bruises on his thighs. And then when we talked about it, we discovered that the child became unusually anxious when it was time to go to sports practice. And he was not ready to dress or undress in front of others for swimming lessons. And that's how we got to know that someone in the, we got to know that someone in the school had tried to molest the kid. So Maya was a 4-year-old girl who became extremely fearful and clingy, and she used to enjoy playing with her nanny. But suddenly she started to cry and refused to go to her. So signs which were noticed were she had frequent nightmares and trouble sleeping. In her sleep also, she used to mutter, "मुझे नानी के पास नहीं जाना, मुझे नानी के पास नहीं जाना." And she drew disturbing pictures. They were not very discernible, but it was just disturbing. It was like she just crippled like anything. And also, she became distressed at the mention of her nanny's name. So earlier, we thought that the nanny must have scolded her in private or something like that. But when we got to know, then me as pediatrician and the parents, we decided that we should put CCTV cameras inside the house also. And that's how we got to know.
From the participants, if we have any questions, I would expect you all to please ask the questions in the chat. And we also have the link shared with you all for the feedback form. Before we conclude, we would want you all to give the feedback also. Yeah. Yeah, there is one more question, ma'am. A daughter has speech delay and she has a very poor eye contact. How can I identify anything bad touch?
No, this is not about bad touch. If there's a speech delay with a poor eye contact, so this might be a developmental issue. So first you need to visit your pediatrician. We need to see whether or not there are developmental red flags first. Developmental red flags would include your child not responding to their name most of the times. Sometimes they might respond to their name, but other times they might not be responding. So consistently not responding to their names, plus a poor eye contact, plus speech delay. So if there's a triad of these three things, the first differential would be too much of screen time. So this is like too much of screen time will cause all these three things. So first the pediatrician will rule developmental things out, any developmental issues out, and then we can start thinking about it. So that is how we'll approach it.
Thank you, ma'am. There's one more question which had come. Let's see if we can answer that also. When in play area with other children, probably I think elder to them, how to protect the child or what instructions to be given.
So that's what we need to tell the child about the private areas. The private areas. These are the areas no one else can touch. If anything is making you uncomfortable, that's a bad feeling. So we need to tell them about the private areas first thing. Second, the good feeling and the bad feeling. Third thing, You come, you just get away if you're feeling uncomfortable. That is the third thing, what to do. And the fourth thing is tell the person in the safe circle. So these four things we need to reiterate again and again in their mind so that they can tell us, because we can't protect our kids everywhere. There will be seniors, there will be juniors, and especially the children who are less than 20 years, the teenagers also. So there is the whole wrath of emotions there. So that's why it is important to teach the kids about this so that they can tell you this and you can be careful the next time. So we can't be certain anytime, but we need to tell our kids that so that they can tell us about it and we can be careful about sending the kid again in that group. So that is how we do it.
Thank you, Dr. Shreya. So there are a couple of questions which I could see, but as we will be sharing the recording to all the participants, and all the questions asked here are already covered, we would still want you all to stay in touch, and if we have any queries or any specific requirements, we will connect with you. Um, so before losing time, we will want to thank you all, everyone who participated in our Safe Touch Awareness webinar today. We hope you found the session insightful and beneficial. For any further queries or support, please feel free to reach out to us at www.vibgyor.org, or you can call us at 600 3000 700 600 3700 600 3700. The number is also there on the screen. We look forward to continuing our journey together in ensuring the safety and well being of our children. Thank you all.